I made a mistake on a video that we shot a few months back, and I used the word addiction rather than dependence. I was asked the question about, how long does it take for people to get dependent on Suboxone or other opioids if they start taking them. And I made the point that if somebody's trying to detox off heroin or fentanyl by themselves, by getting some Suboxone either on the street or from doctors, if they use it for more than 4 or 5 days, they often will become dependent on it, and then it's hard for them to get off of that. But I used the word addiction instead, so they become addicted to it, and it got a couple of people upset, and I apologize for that because I really should have used the word dependence. So I thought it might be helpful to just explain a little bit about the difference. Dependence is a physical condition that it will happen to really 100% of people if they take a drug that causes dependence, like opioids. So in medical situations, we see that with people if they've got broken arms or legs and they take opioids for a long time, or chronic pain patients who maybe have sore backs or something like that, and they become physically dependent, and that means they have to go through a withdrawal process when they stop it. Addiction is the disease where people have all the behaviors that go along with the disease of addiction or substance abuse disorder, where they're taking extra doses or they're having negative consequences and the other things like that. And that only happens to about 10% of the population that tend to get the disease of addiction, and the causes of that is multifactorial, a lot of it genetics. So there's a big difference between the two, and I should have used the word dependence, so hopefully that helps clarify that.